91.7 FM. I am muted. I'm muted. Dr. Kiba, you're lopsided. Okay.
You're lopsided. Okay. Should I adjust for
yeah,
me?
RadioDoctor is Nigeria's. Your video is off, so I can't see you.
My video is off. My video is off.
I can see you.
Okay,
Okay,
I'll
you
come
can
back.
see me.
Okay.
Okay, can you see me?
Yes, but you are still like,
Okay.
is it upside down? You're sideways. You're not straight.
I'm sideways. You said I'm sideways.
Yes. Yeah.
Okay, yeah, I have to adjust that for me. He was trying to follow the landscape thing. Adjust it a little.
Yes, that's it.
Awesome. Okay.
Okay, they said it's okay.
Okay. All right. I'm gonna just ask you. Okay. Good morning. You're welcome to RadioDoctor. RadioDoctor is broadcast.
Am I better? Am I better now?
Yes. RadioDoctor
Okay.
is broadcast Mondays through Fridays, 10 a.m. And RadioDoctor is Nigeria's first specialized radio health program where medical doctors consult for free and advise you on women radio. Demi.
Today's program is proudly powered by TeleDoc, a secure digital platform that allows you to consult verified doctors anytime, anywhere. With TeleDoc, you can book a quick consult for 10 minutes or a full consult for 30 minutes. Choose your preferred time, join a secure video call within the app. You can also upload medical records, receive prescriptions digitally after your consultation. Every Wednesday and Thursday, we feature trusted doctors from the TeleDoc network to answer your health questions live. My name is Dimladi Okiwale.
And I'm Femi Bangala, and today we're going to be talking about difficulty in getting pregnant, why some women have difficulties in getting pregnant. For some women, pregnancy happens real quick for them. For others, months turn into years and years and years of waiting and hoping and testing and praying and searching for answers. And there's so much fear, so much shame, so much blame attached to it. So today we're going to be asking our doctor different questions like, what is fertility? Fertility challenges, are they common? Why do women struggle to conceive? Lifestyle, age, stress, what do those conditions play in fertility? And when should a woman, how should she seek help as well?
Joining us today is Dr. Adebayo Adekunle, a consultant obstetrician and gynecologist, and he's here to help us understand better why fertility challenges and the factors affecting the conception. Doctor, welcome to the program.
Yes,
Thank you. Thank you for having me. I am happy and honored to be here. Thank you. Thank you for having me.
We are live on YouTube at WFM 917, and you can listen to us on the go via our website, www.wfm917.com. Our phone lines will be open shortly, but you can send your text messages, your WhatsApp messages, or your voice notes to 0703-1756-537 or 08155-917-917. Demi is back from his long sojourn, did not bring chocolate for anybody. So I'm giving him major side eye before he starts asking questions. But Demi is we're glad to have you back on the show. This morning, still expecting my chocolates. I'm not going to forget that. So yeah.
No problem.
Go ahead, Demi.
All right, doctor, let's dive in. So how do you define infertility medically?
Okay, yeah, thank you. But the part of the chocolates, I'm interested. One of the things I'm going to tell you today is that you should not take chocolates if you want to get pregnant quickly. So I'm going to be on both. Yeah, okay. Anyways, like I said, thank you for having me. If you allow me, just give kudos to you and your group for doing a wonderful job. You're making life easy for people around, bringing people like us here to enlighten quickly for free. You know, I want to say well done, well done. So let's dive in because there's a lot to say.
Thank you.
Okay. All right, so good. First of all, fertility or infertility as it is. We try to avoid the word infertility now. We just say trying to conceive, or we use the word subfertility because infertility sounds like a stigma. When you say infertility, like inability, like the person cannot get pregnant. So we try to define it, generally speaking, as inability of a couple, please note, of a couple to achieve and sustain pregnancy after a year. Those are keywords. After a year of vaginal, penetrative, and ejaculatory intercourse. Vaginal, penetrative, and ejaculatory intercourse. So that's the definition of when we say someone belongs to the category of infertility, or let's call it, better still, let's call it subfertility. So that's the definition generally.
Okay, thank you, doctor. So what are the fertility challenges?
Wow. One of the things, why it's funny to me, I'm a fertility doctor, and I've been a gynecologist, been in women health for almost 15 years. So I've seen a lot. So one of the things you see is that, you have two sides, like two extremes. You have those that get pregnant easily, and you have those that do not get pregnant as easy as they would have loved to get pregnant, as the case may be. But when I run my clinics, my gynecology or fertility clinics, 8 out of 10 women that I see are trying to conceive, and these women will do anything to get pregnant. I remember not too long ago in one of our facilities, we took delivery of quadruplets, 4 kids. We took delivery CS of a couple that had 4 children, and this couple already had 3 kids. They now had 4. It wasn't so much of a good news for them. And that same day, I had many people sitting in my clinic looking for just one. So somebody is unhappy that is having too many children. Another person is trying to get pregnant, as the case may be. So the challenges are usually we put it into two. It's a big challenge, especially in our setting where we put a lot of premium on having children. It's cultural for us. I think it's everywhere, but it's more deeper in the fabrics of our own culture here in Africa. But generally, everybody wants to have a child. I mean, very rarely would you have people that would say, I don't want to have a child. Even those that don't want to have a marriage, they want to have a child. We now have people that do donor insemination, donor IVF. Okay, I don't want a husband. I don't want a wife. I just want a child. People do surrogacy now. So the challenges as it is number one, we have it as the male factors and the female factors, because it's an inability of a couple to get pregnant. And I must stress this, as much as we said why women, maybe it should have been better stated as why couples are finding it difficult to get pregnant. Okay, because it's actually a couple thing. And the correct statistics and epidemiological patterns shows that it's almost a 50-50%, way that you find out that men, the same way men contribute equally is the same way for women. And in our culture here, we put so much on the women. Men contribute almost 50% of inability to conceive in present statistics as we have it. And I see it a lot. But jokingly, I was mentioning in one of my programs, because I do a lot of public speaking, I was speaking on my program, I was jokingly saying it was a church program that I think it's getting to a point where we need to start doing sperm analysis as a pre-marriage counseling test. Like maybe find out. Let's find out, because it's very funny, because recently we're going to do a donor insemination. Donor insemination is when you get, maybe if a couple is trying to get pregnant and is the man that is not able to not have a good sperm quality and quantity. So we're trying to do a donor. And I got 4 or 5 young men between the ages of 22 and 28. You know, out of the 5 men, we're trying to test whether they had good sperm. Only one person had good sperm. Only one person. I'm telling you, young guys, all healthy, looking apparently normal. They sperm. One of them had azoospermia, no sperm. It was just, walking around like everything was normal. Anyways, so the male factor is a major factor. Then we have the female factor. If you allow me to run the female factor quickly for challenges, for most women, one of their major problems, and I need to state it very clearly, is age. I know you mentioned something about talking about it later, but it's a good time to say one of the major factors is age for women. And let me quickly run this. I know we don't have more time. When a woman is in the womb, when we have a baby girl in the womb, am I still audible?
Yes, you can hear
when we have a baby fetus in the womb, she has close to 7 million eggs in her ovaries. By the time she's given birth to, it reduces from 7 million to 2 million, 1 to 2 million thereabouts. So that means if a girl child that is just born now has close to 1 to 2 million eggs. So you can see it drops from 7 to 2 million in our ovaries. Unlike women, we make our sperm as we need it, as we have sex, as we ejaculate, as we, but women already have their eggs in their ovaries already. By the time she clocks puberty, which is anytime from 8, 9, 10, 11, 12, thereabouts, up until 15, 16 years, that 2 million has dropped to around 400,000. Just by age. It's a physiological event, that happens naturally. So by the time, but throughout our cycle, when she starts menstruating, she's just going to use only about 400 to 500 eggs that she'll be ovulating every month. If you calculate the number of years from when she's reproductive and all of that, she's just going to use just 500 thereabouts. However, when a woman begins, the best time for a woman to get pregnant is between 16 and 24 years. That's why you find out that you find high abortion rates in that age group, 16, 17, 18, 19, 20, 21, 22, because you just say, let's call it clock 30. Some decline begins to come in. Life is not only about children, I agree, but if your plan is to have children, it may not be a bad advice to say, starts up as soon as you can. Let's not put an age to it, because we all have our individual stories and differences, but as early as you start the business. That's why we talk about purpose-driven life. You start, when you want to do this, when you want to do this, if all of that is equal. So age is a major factor. Other factors for women is we try to put the respiratory tracts of a woman into factors. We have the vaginal factors, we have the cervical factors, because the woman's womb has the womb, the uterus, has the cervix, has the tubes. So the womb itself, the cervix can be blocked. The cervix can have producing some materials or some chemicals, some antibodies that can be working against the sperm. The womb itself, the uterus itself, may have problems. For example, people may have fibroids. And fibroid is a major thing, a major thing. A third of women, Black women, Nigerian women would have fibroids. And the fibroid could block your tubes. The fibroid could affect implantation. In fact, most of the time, we have to do fibroid surgery for them to get pregnant. For those that need to do surgery, not all fibroids need to do surgery, but sometimes fibroids can need to do surgery if we are able to prove that the fibroid is the cause of infertility. Then we go to the commonest factor in Africa, okay? It is the tubes. The tubes is just the same way I am. If you can see me, you can see me, right? Okay?
Yes.
So the womb is just like this. This is my body is the womb, and it has 2 tubes with fingers like this. They call it the female end. So when a man has sex, it pours in the sperm moves. So we have the ovary on the side and another ovary on the side. That's the same. That's the way the reproductive tract of the woman looks like. Okay, so every month, one ovary produces an egg, and the egg goes into this. Can you still see me? The egg goes into the tubes and migrates into the tubes, and somehow is waiting there. And then if the woman, if at the time of a fertile period, the egg is there waiting, and then the egg can only stay there for 24 hours. Unlike the sperm that can stay for 5 days. 5 days. That's why if you have sex 4 days before your ovulation, you can get pregnant. 3 days, you can get pregnant. Up until the ovulation day, you can get pregnant. All right. So the egg stays there, and then the sperm goes in. If it's the time that one has, that's why we cannot overemphasize the fact that adequate sex is key. I met a couple not too long ago that told me they're trying to get pregnant, and they sat down in front of me. And it's very funny. I asked the question. So have you been having adequate sex? Adequate sex is 3 to 4 times a week. I don't know whether but that seems a lot for some people. I wonder, I don't know why, but 3 to 4 times a week, that's where it's supposed to be. And I asked them, when was the last time I tried to get pregnant? They said, yes, we have been trying. The woman was almost having wet eyes. So when was the last time you had sex? They had sex, the last time was 5 months ago. I was like, okay.
They cannot get pregnant though.
I think, maybe they're looking for another Jesus or Mary or something, maybe the Spirit.
You cannot even get pregnant with that.
I had to tell them that day that what we do as fertility specialists is to optimize the man and optimize the woman so that they're in their best fertility status to be able to impregnate each other. Is when they can't do that or we can't do that, we're now asking for what they call assisted reproduction, which is probably if you have time together. So where I was going through is the tubal factor. If the woman, we get, the sperm goes up and there's a blockage. So you can picture what I'm saying. If there's a blockage here or a blockage here, the sperm cannot meet. The egg is waiting. I want to get pregnant. but the sperm is going to stop here because it can't reach the egg. And even if mistakenly it struggles to reach the egg, maybe by sometimes it's difficult for the fertilized egg to come in to the womb because there's a blockage. They're like pipes. And that accounts for almost 60% of fertility problems in Nigeria. Most of the time, what causes it is pelvic inflammatory disease, ST, sexually transmitted infections. So most of the time, when we joke about it, and we say so many things about sexually transmitted infection, safe sex. Nobody's saying anybody should have sex. When you are going to have sex or when you don't have sex is a personal matter. But have safe sex. Okay? Safe sex means use condom when you are not yet, basically, until you are certain, then be faithful to one partner and all of that. Because, even if you say you are faithful, if you say, no, it's skin to skin, skin to skin, skin to skin, okay, no problem. The person you are faithful to may not be faithful to you. What's that popular song? Even your boo get a boo, nobody knows. Who can have who and what you can. Nobody can say I trust you, I don't trust you, except So for every episode of sex, from someone that has an STI, there's almost a 15 to 20% chance of a pelvic inflammatory disease. For every episode of pelvic inflammatory disease, there's also a 15 to 20% chance of a tumor blockage. So you find out that even by the time, and imagine, most people start having sex around 16, 17 years from most studies in Nigeria. Okay? So imagine somebody starts having sex from 16, 17 years. Okay? And get married maybe 24, 25. Number one, picture the amount of sexual partner the person will likely have. That's number one.
Right.
Number two, if the person has the infection, is most likely to have caused, and that's what we see most of the time. So one of the two commonest things we see in couples now is the sperm factor, the male factor very, very much, and the female silver factor from infection. Other factors, the endometriosis, there's something called endometriosis that also cause scarring when the lining of the uterus is outside, causing scarring immobility. Another very strong factor is the ovaries itself, which is something we call PCOS, now called PMOS, polyendocrine metabolic syndrome. Yes, so PCOS is called, where there's ovulatory problem. And that accounts for almost 15% or most 50 to 20% of most fertility problems that we have amongst women, okay, by having ovulatory factors. Because with PCOS, it's difficult for a woman to ovulate or have quality ovulation. So those are the general factors for the women altogether, apart from other lifestyle factors that you still ask me about and all that. So generally speaking, those are the factors that are responsible for infertility amongst couples.
Wow. I mean, you've already touched on most of our questions. You've already touched on most of our questions. David, let's just jump to.
And I'll still try to make them as brief as possible.
I actually want to ask my next question quickly. So from your experience, doctor, are fertility challenges becoming more common, or people are just simply talking about it openly nowadays?
So I think it's both. Okay? It's more common. We're having more tumor factor problems. We're having more male factor problems, which wasn't so much in the past. Like I said, I've been doing women health for almost 15 years. So I also see the trend of how the common factors are becoming, some are going down and some are going up. Male factor is going up, tumor factor is going up, then ovulatory factors are following in that order. Okay, so it's becoming more common, people talking more about it now because of the stigma attached to it. I give you too many stories. Okay, there's a recent person, and it's very, very problematic. In fact, sometimes these days I have to have a lot of tissue in my office. As a matter of fact, when I'm starting my clinic, I will tell my assistant, please, I have tissue, because there's hardly any clinic I'll do that will have one lady or another lady that would cry. This is true. I'm a human being too. It touches me too. And sometimes you're like, okay, I just wish I can just bring the baby and just teach the person. But I'm not good. Okay, all we can do is to do the best we can. But of course, people are having results better still. So because also we have more options now than before. So I'll answer your question by saying it's more common and people are speaking out a little bit more. There's also more liberties now. Like I said, some people are now saying, can I do donor? Can I, talk? Can I see other assisted reproduction? Can I do it? Can I do insemination? Can I do IVF? The information is now more available, unlike before when it was so available. So people are coming out more now. Women are speaking up more. Women are challenging mother-in-laws and and family of men and all of that about the possibility that this may not be my problem. It might be the husband's problem too. Oh, it's our problem. We shouldn't even say it's anybody's problem. It's our problem. I know. I usually joke when I talk to couple, whether they are pregnant or not. I said, "You guys will get pregnant." I say, "I'll tell you that when I had my kids, I just say, after the kids, I want to do naming ceremony. When I send the messages to people to go and do party with us, I write, we were pregnant. We are giving birth." Not that my wife just gave birth to a baby. No, we did it together. Because even me too, I went through things when she was pregnant. We also go through things. It's not only the women, but that's maybe another question entirely.
No, I absolutely agree with you. I agree with you.
Yeah, it's more common, and people are speaking more about it because women speak more now. If you notice, about themselves, about their purpose, the same way it has affected fertility. So women are speaking more. Women are saying, okay, if you don't want to, if you're disturbing me, do you want to go out of this marriage? They're having options. Oh, should I do donor? Oh, what do we do? But generally speaking, what I've realized is that the best thing is just still that for the women and the men, regardless of the factors, to seek the options available for their individual problem or family issue, if there's an issue. Unfortunately, there's also a 20% group. I forgot to mention that is unexplained. They call it unexplained infertility. When you have checked all the factors and everything is fine, but they're still not getting pregnant. Of course, there's a guideline for managing that. I hope I've answered that question, Summer.
Yeah, thank you very much, Doctor. Doctor, many women may have concerns about irregular cycle, fertility symptoms, difficulties conceiving, but they may not know where to begin. So how can telemedicine help?
Oh, wow. So telemedicine is, like I said, I would say kudos to you again. You guys are doing a great job, and I hope people can, latch onto these opportunities, because I don't want to mention so much. People, in fact, one of the things I'm saying now is a lot of people are consulting me. I am a Nigeria, UK trained and gynae, but I practice in Nigeria. I'm in Nigeria. So I see many people coming from the abroad to come and consult me now, because it's a whole lot having to see a gynecologist of my caliber. You may not see, they give them 6 months appointment, 1 year appointment, because it's not an emergency. They don't see fertility, but for the person going through the mental stress, she knows it's an emergency.
Yeah.
Because they are dying, depression, suicidal ideation. Yeah. Mother-in-laws, family members, and all of that. Some of them as attached to their being, their happiness. It is very terrible, actually. So what telemedicine, what you guys are doing, which I wish that we can have people grab this opportunity, is that now you are bringing people like us to talk to them. What I'm saying now, if you want to see me, you will pay. Okay, now you have to go through it. It's almost like if you're not paying. It's technically like you're not paying. They get information, most of them free, some subsidized, and that's what telemedicine is doing. And for all these things, all this information are available with you guys, which I believe you're making available for them, and they should grab it. Now, for those that have irregular cycles, those that have ovulation problems, we have information here, and I know you have it too, because I'm part of you actually. So we have information here, okay, to make sure that this information is available for them. Number one, if you have, and I'll give you a little, if you have irregular cycles, you should find out why. Check your hormones. You could have what causes this in close to 80%, like I mentioned earlier, is PCOS or PMOS as it is called now. So you know, because a normal person should menstruate for between 2 to 7 days flow. It can be anything between 21 to 35 days in a 21 to 35 day cycle. Maximum cycle is 35 days. Minimum is 21. The common one for 30% of women is 28 days. That's why you see us talk about 28 days, 28 days, 28 days, 28 days. Only about 30% of you have 28 days. So my wife has always had a 25 day cycle, and still she has that. Okay, so it's not as if you don't have it, because people come to you and say, I don't have a regular cycle. Okay, tell me about. So women don't even know their cycle. You're not okay. When was your last menstruation? So they will ask their husband. So they can't remember. Some of them will look for the last 01. The last 01, they that party that I went in Ijebu. Oh, that's when I now saw the flu. The thing almost embarrassed me. Then I look at the dates on the calendar of the party. It's very common. The funniest one is the one that husbands. I have some husbands. Some husbands keep more records than their wives. And that's very sweet, actually. So you want to look at the man. Only when was the time? And the man will say, oh, it was on the 14th. Very sweet. You know that kind of mind is involved, actually. You know, that's what it means.
Yeah.
Okay.
Yeah.
So if you should have a regular cycle, so regular cycle means you are in that range. And that whether it is a 20, it can be 28 today, 29 tomorrow, 20, but it must not go beyond 3 to 4 days of the last cycle. If you still have 2 to 3 days difference, 28 today, 27 tomorrow, 29 next tomorrow, that's still a regular cycle. It's not an irregular cycle. And it comes in that order, it comes regularly like that. But we are beginning to have, you stay from one first day to another first day, you start waiting for 35 days and above, or you skip 2 months, 3 months. That's an irregular cycle. Okay, or it's less than 21 days in between. That is too frequent. Okay, and that also has its own issues because it could be pathological. We need to check whether the person has some hormonal problems, fibroid problems, thyroid problems, and all that. Okay, so irregular cycles means it goes beyond the 35 days or is skipping months and all of that. That's irregular. And most of the time, 85 to 90% of those that have those kind of cycles are not ovulating. And ovulation is the release of egg. The egg will meet with the sperm that forms a baby. You know what I mean? So if the egg is not coming out, then there's no way fertility or fertilization would happen, and there's no way you're going to conceive. So if that's not regular cycles, there are some telltale, apart from the cycle, the truest test for a regular cycle is pregnancy, actually. So say, okay, do I ovulate? Do I have regular cycle? It's pregnancy. If I've been pregnant, so you have been ovulating. The second one is that sometimes we do hormonal tests and all that. So the thing is, the regular cycle, sometimes some people want to have what we call presumptive symptoms to know whether I'm even fertile. But I must mention this. We put too much energy and premium on the issue of ovulation symptoms. I know the ovulation symptoms, for example, around the mid-cycle, some people may have some discharge that is stretchy like egg whites. You know, some may have low abdominal pain. Some will have slight increase, like 1 to 2 degrees centigrade in their temperature. But these are presumptive signs or presumptive symptoms. Only 30% of women would have it. So I want to state it clearly here. That you don't have those symptoms does not mean you are not ovulating. You can still be ovulating and not have those symptoms. I don't know if what I'm saying is quite clear, okay? Because I ate a lot. Doctor, I'm not ovulating. If you're having regular cycles, 85 to 90%, you're ovulating. I don't understand. If you have been pregnant before, you're likely to be ovulating, or stress, a problem has come and all that. But however, those things are also some things that we can say, okay, we can presume that you're ovulating. Hormone tests and all that, we can help to know those kind of things. And I know all this information is ready and available at TeleDoc for more information and for them to grab it.
Thank you, Doctor. You're listening to Radio Doctor on Women Radio 91.7, powered by TeleDoc. TeleDoc allows you to book at your preferred time, join a secure video consultation, upload medical records before speaking with your doctor, and receive prescriptions digitally. It is healthcare made simple and secure.
The phone lines are now open: 07000 917 917 or 800 1235 917. You can text us or WhatsApp us or send us a voice note on 0703 1756 537 or 08155 917 917. The time right about now is 23 minutes to 11, and we've been speaking with Dr. Adebayo on the topic why women find it difficult to get pregnant. So if you have questions about fertility, reproductive health, conception, other related concerns, you can do it now within this window, because you heard the doctor say that if you do it outside of this window, you will pay, because you see he's Nigerian and UK trained, so don't play with him. Okay, I'm just going to jump straight into a question to you. At what point should a woman seek medical evaluation for difficulty conceiving? Because you've answered most of our questions, so I'm just going to go down to the treatment.
Okay, so at what point? So generally speaking, we generally say a year, but it's not hard and fast. Okay, and this is the basis of the 1 year. I'll try to rush. Now, within a month of a couple, a fertility, whose fertility status is okay or healthy, if they meet within a month, the possibility of getting pregnant, they meet 4 times, meet at the fertile window and all that, the possibility of getting pregnant is just about 25%. So it doesn't mean that if I meet this month, we must get pregnant. That's right. And pressure starts from immediately after marriage. They'll start counting the months for them. Okay. Now, at 3 months, this increases to around 40 to 50% when they meet constantly for 3 months. Okay, 6 months, this increases to about 60-65%. By 1 year, it increases to almost 85%. That means I'm talking about a couple that has no problems, no issues. So by 1 year, 85% to 90% would have gotten pregnant within a year if they meet adequately. You can say, we're going back to this coital or coitus, as the case may be. Okay, so, and if they don't seek medical attention and they continue meeting for 2 years, 95% of them will have gotten pregnant. So we generally say, if you are less than 35 years, wait for a year, meet very well, you know. But if you are more than 35 years, remember I gave you that 35 years cutoff, that I said a third of gross fertility potential has dropped. If you are more than 35 years, about when it's best to check on your fertility status.
Okay, so what does a fertility, what do they test, the process, what does it typically involve? That's from when the lady comes into your office, what does that whole process look like and what does it involve?
Great. So the first thing is that the patient comes into our office. We like to see both of them. It's always very nice and it's rewarding for me as a fertility doctor okay, when I see the husband and the wife coming together. Okay, it makes life so easy for us. Okay, and of course, for obvious reasons, which I've explained earlier. All right, so when they come in, we are going to ask them questions. We take their history, ask about some things, like something like smoking, like alcohol. These are anti-fertility things. In fact, if you want to get pregnant and you smoke, just stop it. Either as a woman or as a man. It disturbs the tubes, it reduces ovulation, it affects sperm. Alcohol too affects erection, affects sperm quality.